Hello, everyone. My name is Ashley Pena. I'm a movement disorder specialist at Mayo Clinic, Florida. And thank you for joining me virtually to talk a little bit about Parkinson's disease. So my aim with this talk was really to provide just kind of practical tips and tricks for real life management of Parkinson's across the lifetime, and also to focus in on specific things that patients really want to know about their disease. So Parkinson's disease is the second most common, but the fastest growing neurodegenerative disorder. The average age of onset is about in the seventh decade of life, and it is more common in men. So how did I get this? Patients are always wanting to know what has caused their Parkinson's. There is kind of a complex interplay of genetic and environmental factors that contribute to the development of Parkinson's. So environmental factors increasing the risk for Parkinson's I have highlighted here in red. Pesticide and chemical exposure, most notably insecticides such as Agent Orange, heavy metal exposure, your welders, your miners may be at increased risk for Parkinson's. Repetitive head trauma, usually with loss of consciousness, can increase risk. And then protective factors are listed there in green. We'll talk a little bit more about exercise later, as it's probably the most compelling. So the genetics of Parkinson's, so really not terribly common that Parkinson's is truly hereditary. It's less than 10%. There are autosomal and dominant and recessive forms of Parkinson's. There are commercially available panels for this, but also important to note that there's a lot of phenotypic variation and very incomplete penetrance in these cases. You might have patients that have anything from tremor that looks like essential tremor to dystonia, or they may develop no symptoms at all despite carrying a culprit gene for the development of hereditary Parkinson's disease. There are also kind of a different genetic mechanism would be kind of genetic susceptibility, so genes that just increase the risk for developing Parkinson's disease. This is by far and away the more common scenario. And in this situation, you might see a family member here or there who has been affected by Parkinson's disease, but it is not truly hereditary. So basically the take home for patients is that Parkinson's is rarely purely genetic or environmental. It's thought that it requires multiple hits, and that there is a genetic predisposition that's likely unmasked by the cumulative results of environmental influences across the patient's lifetime. So all very individual. So a little bit about the pathophysiology of Parkinson's disease. So we have alpha-synuclein aggregates that begin to accumulate years, if not decades,